The doctor is in.
Happy Wellness Wednesday, Ricky. The doctor is indeed in, and man, we got a show for everybody. So this is a topic that I think has been on lots of people's minds, and they haven't known how to ask. There hadn't been a ton of research about it, but it's something that we need to talk about amongst our survivors and our caregivers, especially, and in our community, and that's Alzheimer's and breast cancer, right, Ricky?
Yes, Alzheimer's and breast cancer and caregiving. And there's so many things that overlap, having breast cancer, not having breast cancer. So I think we're going to talk about it all tonight. And we are just so excited to have these amazing, amazing guests. And why don't we go around and let everybody introduce themselves, and we'll get into the conversation. And I can share some facts. But let's talk about who these awesome people are that we brought together. Some old friends and new friends. So JC, you go first. You're on mute, JC.
Glad to be here, Dr. and Ricky. I'm going to have my mom, Gloria Cash, introduce herself. You want to introduce yourself?
I'm Gloria M. Cash, and I worked for USDA, United States Department of Agriculture, and that's when I found you the person who usually eat properly. Certain foods you just shouldn't spend too much time on. Now that might have been some thought that I didn't recommend. So anyway, I am doing wonderful now. I'm feeling better. I am back into my regular clothes where I lost when I was not size that I usually is. So right now, I'm on the right track, I think.
Thank you.
Beautiful.
And I'm John Cash. I'm the oldest son. We reside in the greater Charlotte metro, Charlotte, North Carolina metropolitan area. My brother and sister-in-law reside here too. 3 months ago, I moved my parents in with my brother and sister-in-law from their home. And I'm the caregiver and for both my mother and father, and power of attorney for them. But again, we take a family approach to managing my mother and father's affairs.
Great. And your mom had breast cancer before she was diagnosed with Alzheimer's, right?
Yes, my mother was diagnosed with breast cancer approximately 06, 07, and she's a thriver, a breast cancer thriver and overcomer. And she was diagnosed with dementia approximately 2013. Right now, she has moderate Alzheimer's. She's reviewed semi-annually, and actually we have an appointment coming up in April.
Beautiful.
Well, welcome.
Yes, yes.
And
And he
Pat,
has always been there to let me know, to let the doctors know what actuality consists of.
All right.
I kept moving along.
And mom, what should we call you? What would you like for us to call you?
You can call me by my name, Gloria.
Miss Gloria. Did you go through surgery and radiation or chemotherapy, or what treatments did you have, if you recall?
Yeah, surgery
Okay.
on that side
Yes,
that I
ma'am.
had cancer on.
Right. Well, you're still here, thriving. I love it.
That's
Oh
right.
yes,
I
I
love it.
haven't had any problems
Great.
from the doctor or anyone else so far.
Great.
So that's really, it's a good time to look at things like that.
Yep.
It's a
Tell them
blessing.
don't bring you no
And
bad news.
we have now moved with our son and their family from DC, Maryland, and Virginia, where we were
Great.
nearby. So we are no longer in the nation's capital.
But you're in a great place to
I
be
have
taken
been
care
there
of.
for several years, many years,
Great.
working.
Great.
Okay.
Great.
So
Pat and Jeanette, welcome.
thank you.
I'm here.
Okay.
My name is, Reverend Jeanette Jordan. I'm pastor of Journey to the Cross Ministries of multi-denominational church out of Park Forest, Illinois, a suburb of Chicago. I'm presently in Duluth, Georgia with my daughter, helping her with my 3 grandbabies. Having a good time here. Anxious to get back home, which will be Tuesday. I'm going back home so I can get my second COVID vaccine, and then I'll be safe traveling around. My story is my husband is the one that suffers from Alzheimer's, dementia. He was a practicing pediatrician for over 35 years. Prominent pediatrician in the city of Chicago. He was the first Black chief resident at Rush Presbyterian St. Luke Hospital, where he did his medical training and his residency. He practiced up until 2017. He was diagnosed with Alzheimer's in 2016, I would say, or 15, after our family, or after I came out of denial. And able to tell the world, well, maybe not the world, but my family, who's my world, that he was having a problem with remembering, calling me 4 and 5 times a day to see how I'm doing, as though he had never called me before. Just a lot of things happened. A lot of things that I had to come to the realization that I had to take the wheel, and for his safety and for the family's safety, had to do some things. And the things that I had to do, eventually give myself permission to have him go to a long-term care facility. And that's one of the things that I want to tell caregivers. There may become a time in your caregiving that you may have to make the dreaded decision to place your loved one in a long-term care facility. And when I say give yourself permission, there's so much stigma attached, especially in the African-American community, with having to put your loved one in a long-term care facility. It's like abandoning them. I mean, if that's your mindset, then that's the wrong mindset to have. But we placed my husband in a long-term care facility for his safety and for our safety. He became combative, he became agitated, he was not happy. He left home, and I didn't know where he was. I had to eventually call the police to go look for him. That was terrifying for me as a caregiver. And finding that he would turn on the oven or the stove, tried to cook, but forgot he was cooking, and then he would go off to do something else. And just those types of things happen. And if you don't have the ability to give them 24/7 care, then you're not being fair to them. You're not being fair to yourself as a caregiver. And so we made the decision that he would go into a long-term care facility, who's doing an awesome, awesome job. But when I decided that that's what we had to do, I went into that long-term care facility and I let them know that I'm the lead caregiver. And these are my expectations. He is Dr. Jordan, and we call him Dr. Jordan. He deserves that, and he answers by that. I want to make sure that they gave him the dignity and the respect that he deserved, and that I would be there as often, probably more than those that are on staff, because at least they went home after so many hours. I would stay there as long as they would allow me to, making sure that they were caring for my husband the way that I would. When, of course, COVID hit, it was traumatic for me and my children, because then we could not see him. And then I called to say, well, how am I going to make sure you're taking care of my husband? And that's because I'm the lead caregiver. I can tell you what I want to do. I want to FaceTime. I want to do something. And they do. Every Friday, we FaceTime. We duo chat. So I can see his condition and see that they're caring for him. And so, yeah, I come from Chicago, but my kids have me to come visit with them because caregivers need caregiving. And so I get all wrapped up in my husband. And then if I'm no good, then what good am I going to be to him? So my kids definitely care for me, and I appreciate that. And I encourage caregivers. You need care for yourself, because that person that is suffering, I call it BOED, beast of a disease. And that person will be here when you're 6 feet under if you don't care for yourself. But you know, that's just my journey, and I became an advocate for those suffering with Alzheimer's, and an advocate for the caregiver. Giving caregivers, like I said, permission. If you have to put your loved one in a long-term care facility, it's okay. Don't care what anybody says. It's okay as long as you're caring for the person that you love. Oh my God, that's kind of my journey. Advising people to come out of being in denial early on, so that you can get a diagnosis early on. Had I come out of denial, the progress probably may not have happened or progressed as rapidly as it has. Although he's fine physically, but his cognitive ability has declined rather rapidly. He does not know who I am now. But I have to tug at him and say certain things that kind of perk up his, oh, okay, his memory. But we need to, in our community, again, we have this stigma of not wanting to say that our loved ones are suffering anything, whether it's Alzheimer's, whether it's breast cancer, whether it's diabetes. We want to keep it within our little space, in our the comforts of our homes, and not seek the care that's available to us. And so I encourage those that are seeing any slight change, know the 10 signs of Alzheimer's. It comes on very slowly. It's not an acute condition that just happens today. But you know, when you start forgetting where you've placed something more often than usual, then it may be a concern. And there's nothing wrong with going and seeing if in fact there's something going on with your cognitive abilities. And then I also host together with a young lady, Michelle Mason, a monthly Women of Faith caregiver support group that's sponsored by Alzheimer's. And we come on space just like this, to be the face, to be the place, the safe place where we can come on and talk and cry and get hints on caregiving, and to also give resources for those who are looking for resources. But we find that most oftentimes caregivers need just to talk about it so they can share that they're not alone. You're not by yourself. What you're going through, someone else is going through the same thing. And so you share that and you cry together, and then you learn how to go into the person that's suffering Alzheimer's. You go into their world. We can't bring them back into ours, but I sure am enjoying my husband's world. And if he wants to examine me and listen to my heart, that's fine. If I'm his patient and he wants to write some progress notes, that's fine. And they allow him to do that in the long-term care facility that he's in also. During this journey, we wrote a book, and it talks about our life before Alzheimer's. But the thing about that is, at the end of writing this book, we were able to know enough about his life to finish it off. We finished it in 2017, and that's really when we retired him from his practice in June of 2017, when his license expired, his malpractice expired. We just did shut it down. Had the ability to sell his practice, which you can't sell practices anymore, but the Lord was with us and we were able to sell his practice and give him just the best life that we can now. And so we have his book available that encourages young folk that no matter where you come from, whatever your socioeconomic orientation may have been, you can reach your goals and reach your dreams with hard work and just stick-to-itiveness. And if this happens at the end, I look at it and say, thank you, God, for where you took us from and brought us to. And now he's teaching us how to deal with this BOED.
Great. We'll put that in the chat. So thank you. Wow. Thank you so much. Thank you so much. And Dr. Karen, my Dartmouth sister,
Yes.
her proud green, my Dartmouth sister. And go Karen, she's a badass, you'll see.
Mhm.
Yeah, I'm Karen Marsh. Thank you both for inviting me onto this presentation. I'm very happy to be here and to meet the other panelists. So I am an assistant professor of neurology at NYU Langone Health Center in New York City. I also am the co-director of the Center of Excellence on Alzheimer's Disease and the administrative director for our Alzheimer's Disease Research Center. So I've been in the Alzheimer's field at NYU for the last 22 years in many playing very different roles. So during that time, I've led caregiver groups. I've led groups for early stage patients. Right now, we've expanded and we have a lot of different services for Alzheimer's patients. We provide diagnosis and treatment. We also have a very robust research program where we have NIH-funded research, which is research funded by the National Institutes of Health, and clinical trials. So it's actually been a real pleasure for me for the last 20 years to work with Alzheimer's patients and their families and their caregivers.
Awesome.
Thank you for that.
Yeah. Mo, so I just pulled some data, like I try to do that.
Mhm.
Basically, someone in the US develops Alzheimer's every 65 seconds. But by 2050, that's projected to be every 33 seconds. So I'd love to talk about that and what that, how do we even know that, right? But also, Black people, of course, we get everything worse. We're twice as likely to develop Alzheimer's than white people, but are less likely to be diagnosed. So what's that about, right? That's a little scary. And then this one really knocked me off my feet. 30% of caregivers die before those they are caring for. And a
Wow.
lot of that has to do with, kind of getting depressed, but getting autoimmune diseases, but also not finding time to go to the doctor to get your mammogram, to get your PSA test, to get your screenings, right? Because you're so busy taking care of your loved one, you don't take care of yourself.
And it's challenging because things like colonoscopies, for example, somebody has to drive you. So somebody else has to take a day off from work, right? And you've got to do a prep and you got to be in your bathroom. And if you're a caregiver, those are really challenging things to do. Even a mammogram, somebody has to care for the person that you provide care for in order for you to get away to do that preventive health maintenance. And so, notwithstanding the stress, I think physical and emotional that caregivers go through, stress can manifest in the body as illness too. And so there's a lot of things that, caregivers need to be aware of. And on the subject of Alzheimer's and breast cancer, I've been digging into this, Ricky, ever since you asked me this question. And the most recent data that I found is an article out of JAMA, the Journal of the American Medical Association, from last year. They looked at 57,000 perimenopausal to postmenopausal women with breast cancer. And they looked at women who were taking anti-estrogen therapy. So women who were taking tamoxifen or one of those aromatase inhibitors like Arimidex or Letrozole or Anastrozole. Some of those names sound familiar because after your breast cancer, if you have hormone positive or ER positive breast cancer, your medical oncologist will offer you a pill to block your estrogen. And they are saying that the number of women and the length of time that these people took that estrogen blocker was associated with a decrease in diagnosis of neurodegenerative disease, specifically Alzheimer's disease. Now, I found a lot of confounders in the study, meaning a lot of things can influence it. Like we might not offer it to people who have high risk for Alzheimer's disease. Black women, for example, might be more prone to hormone negative disease, or, may be less inclined to take that anti-estrogen therapy. So there's some things that could be teased out of this, but they are suggesting that taking that estrogen blocker that everybody hates, it gives you hot flashes and vaginal dryness and joint aches, could maybe have some neuroprotective effects. And I thought that that was something that is worth future research and discussion, especially with the companies that that make these drugs, to look at, what is happening in Black and brown women and whether or not we're really included in those trials, because that is something that we need to look at, especially if we are diagnosed more often with Alzheimer's disease. So, I think that there's much work to do, as you always like to say.
Yeah, much work to do. So Karen, do you think that, help me understand too, the whole thing about people not being diagnosed?
Well, a lot of research shows that African Americans, they do come to diagnosis much later in the disease. So many times, once we see people who are African American or Latino, there might be at a moderate stage of Alzheimer's. So one of the things we do, we go out in the community and we really give a lot of talks about the importance of early diagnosis. Sometimes people, though, there are a couple reasons why I think people don't come for earlier diagnosis. And one is this misconception that people are just getting senile and it's a part of normal aging and there's nothing wrong. And that notion is pretty fast in our community sometimes. And even though as people get older, they do lose, there is a small amount of memory that you lose. It's certainly not what I remember my grandmother used to say, senile, she's senile. It's not a normal part of aging. So that would be one of the most important things I could say. So if you have, and Jeanette had mentioned the 10 signs of Alzheimer's disease, if you start misplacing things, having trouble word finding, it's worth going to the doctor and see if it's just normal aging or if something's wrong. I think that the second part.
Wait, hold on. What about chemo brain? That happens to me every day.
Well, yeah, that's a real thing, but different than Alzheimer's.
Yeah.
But certainly we see that, when after women have had women or men have had chemotherapy, that there are memory problems, but they're usually not long lasting like Alzheimer's. One of the things that we do at our center is try to distinguish between those things. So when people come and they say, oh, I have memory problems, we look at, well, why is it? Is it because you have dementia? Is it something that's it can be reversed? Some people come, they're depressed and it affects their memory. Stress affects your memory. So that's a big part of what we do. Why it's also important to go to the doctor, because they'll make a diagnosis, so you'll know exactly what's wrong.
And with my husband, although when I did take him, he was still very, very crafty in denying that he was having a problem. He never admitted that. So crafty that when we took him to the psychiatrist, he was able to convince the psychiatrist he was just preoccupied. He says, man, you know how it is when you out here working like we work. I'm preoccupied. And so the way he said it to the psychiatrist says, Mrs. Jordan, he's preoccupied. You know, that's the stress that he's under. So we left that office with no diagnosis at that time, and back home for me to continue to see this decline. When finally it got so bad, I took him to our primary care physician, who happened to be a friend, that was able to just see this decline. Although he never would take the cognitive test or the written test to make the diagnosis. But then he did tell him, man, you need to just go back and just see the guy that you were talking to and just, check him out. I mean, it took a lot of convincing and conniving and to get him to go and to get him to be tested so that the diagnosis could be made. Because like I said, he was very, 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 very crafty. He wasn't losing his memory. He was just preoccupied.
John, did you notice symptoms in your mom? Had you kind of started to see some of the early signs?
I guess really she brought it up to us. It's a different situation. I think she knew something was going on and she couldn't pinpoint it. So while they were living in DC Metro, we went and visited the doctors and was diagnosed as dementia at the time. And so once that diagnosis came back, we just put an action plan together of how we're going to manage this, and had family discussions that, you know, we have to look at doing things differently. It's pretty ironic because, you know, how do you make God laugh? Tell him your plans. So we had our plans, but God had other plans. So once the dementia was diagnosed, she has always been in great spirits. So I'm so thankful for that, to God for that her demeanor has been great. And then as soon as we relocated them from DC to Charlotte, we received references to secure a dementia Alzheimer's doctor. We got engaged with the local Alzheimer's Association. My father's sitting in the back, and it was very important for him to also understand his role in this process. And what really helped him a lot is being, for a 12-week program, we met once a week for about 2 hours. There were approximately 12 couples at various stages of Alzheimer's. And I went as caregiver. I was the only caregiver out of this group. And this really helped educate my mother and my father that they're not alone, that there is a process that we can work through, and that it's about the support group. And I think that was really critical. And then also engaging my wife and my brother and sister-in-law. They didn't see it through my lens. I saw it much more acutely through my lens, but now they have also come on board. And like I said, we have an action plan and we're working through it now.
You know, I'm thinking that in my husband's case, because he was the head of the house, he was the head of the household. He was trying to hold on to making sure that he cared for his family, because even in the late, as the diagnosis or as the condition progressed, his thing in his mind was how am I going to take care of my family? How are we going to eat? How are we going to pay the bills? I have to go to work. And that was the thing that just kind of drove him, I think, to being in denial, because he knew he wanted to care for his family and he was trying to hold on to it with all of his might. And he did not want to admit that there was any problem. He never, ever admitted that he was having any memory loss. Unfortunately, his friends probably could have helped him through because he was a great golfer. But it's so unfortunate that friends go by the wayside when things like this happen. His friends stopped calling him because when he would get on the golf course, he may lose his phone, he would lose his keys, and then the golf round stopped. And so when that stopped, then everybody had to help him try to find his stuff because he would become agitated. So they eventually just stopped calling him to go to golf, to play golf with them. And not only that, they just stopped calling him at all. And that's an unfortunate situation. And that's where friends need to know too, that don't abandon your loved ones when they have a disease. That's when they need you most. And that's when the family needs you most, because you become the caregivers along with the the biological family.
Dr. Karen, could I ask you a really basic question that some people might be wondering and thinking, and maybe address it a little bit, but what is the difference between dementia and Alzheimer's?
Thank you.
And then are there stages? What are the stages?
Sure. So Alzheimer's is a type of dementia, and it's the most common type, but there are many types of dementia. Some are reversible and some are irreversible. So an example of an irreversible might be the vitamin deficiency. Then that's why, again, we focus on early detection, because that can be solved, that can be treated. So that's the difference between dementia and Alzheimer's. Alzheimer's is a type of dementia, and there are different stages of Alzheimer's. So current research really, I think scientists now think that it starts maybe 20 to 25 years before you even have any symptoms.
Wow.
So that's called preclinical AD. And then usually when we see people, they have mild cognitive impairment. So they're still able to function, but they do have slight memory loss, but still able to perform activities of daily living. The next stage would be early stage Alzheimer's disease, where living independently becomes a little more difficult. The memory loss is a little more pronounced, maybe some difficulty in thinking. And then there's the mid stage and late stage. So those are the stages of Alzheimer's disease.
Yeah, and then don't you have Parkinson's, you have Lewy body, and then you have vascular. Those are the different types of Alzheimer's also.
No, they're different types of dementia.
Dementia, I'm sorry.
Yes,
Dementia.
that's right. You have Lewy body, you have vascular dementia, frontal temporal dementia. Yes.
Thank you.
Wow.
But where does somebody begin to, where do they start
Right.
if they even suspect, that their loved one might have dementia? Who should they go to? And, I know, Jeanette, you mentioned some of the warning signs, but I wonder if we could kind of talk about them again a little bit in terms of really early things versus, some really glaring red flags. Because some things like forgetfulness are entirely possible, especially like Ricky said, if you have chemo brain, you already feel like you got some trouble grasping at your words and your thoughts.
Right.
Are there any glaring sort of red flags?
I think it's important to go to a doctor and have an evaluation, because I don't think, especially in the early stages, that there's anything so glaring. We hear from Miss Gloria, sometimes people just know something's not right, that their memory's different than it's been for many years. But you start maybe at your geriatrician or primary care physician if you don't have a geriatrician. So actually now it's part of Medicare. Part of the annual wellness check, there's a cognitive check that all doctors will do now. This is something that's relatively new, that was only put in place maybe a couple of years ago. So most of the time, if you go to your primary care physician, they'll do a cognitive check, or if not, if they don't do it, you can ask them to do it. So these are usually short tests done in a primary care physician's office. And it's more of a screening. If after that screening, your doctor thinks, there might be something else going on here, usually what happens is you'll be referred to a neurologist or a center like ours, a specialty center that focuses on dementia, and then you'll have much more testing. So when we do cognitive testing at our center, it's actually probably a couple of hours worth of testing, and they see a neurologist, a geriatrician. We sometimes do PET scans to look at amyloid and tau in the brain. So and then we try to give as definitive as we can a diagnosis. But that would be the path. First, start with your primary care physician, be screened, and then ask for a referral. And again, if the doctor doesn't give you the screening, you can ask for it.
Interesting, so my mom, my wonderful, lovely mom will be 88. She's going to hate that I said that on Zoom today in a couple of weeks. And she doesn't have Alzheimer's, thank you God. But I know that her memory is not as good as it has been. But it's taken a long time for her to recognize that. And I think like your husband, Pastor, that at some point, when you're aging, and we're all aging, I age every day too. Like it's almost like, how do you come to the realization that, wait a minute, this is not, something's going on here, and how do you accept it? And I think it's really in recent weeks where my mother said, my memory's not that good, or she started to make comments about it. But it's almost like that whole self-acceptance that no, things aren't working the way they have in the past, or I'm going to accept now that maybe I'm different, or things I need to look at things differently, or I need more help, or I need, that's a really delicate dance for an independent person, especially an independent Black person. I mean, I think that how do you sort of say, hold on, we got to change some things about how we're dealing with care, and what you need help with, or may need help with. How do you help people through that transition? And especially if they don't have caregivers, maybe that are people around them that support them, and maybe that's when it becomes undiagnosed, right? I mean, JC, your family is a blessing because you have each other and you've come together around this, around your mom and around your parents. But and even you, Pastor Jeanette, you're a blessing to your husband. You had to bring your family involved in it. But how do you get there? How do you say, hold on, something's wrong?
And a follow-up question for Dr. Karen is, at what point do you consider a geriatrician? Because I think a lot of people don't know how to go about that process, or that that doctor even exists, and that it can be different than their regular primary doctor. So if we can talk about both of those things, please.
Yeah, sure. Again, geriatricians are hard to find these days. And I can talk about how you can find a geriatrician. I wanted to also just address what Ricky was saying, though, about very independent people. So when you go into a clinic or doctors for early diagnosis, I think that that's one of the most empowering things that you could do, especially if you do have Alzheimer's disease and you're very early on in the disease. If you go in early, and it's another reason why we really stress early diagnosis, you can be a part of planning and care before the disease has progressed too much. So you can make your own decisions about if you want care in the future, or how you want that care to look in the future. So I think it can be very empowering to many people to be a part of that discussion, and not come to the doctor later in the disease when now it's where people are making decisions for you. So that certainly would be one way to look
So
at
once
it.
you get there is serious, like to,
I'm sorry.
once you make the call to make that appointment takes a lot, I think, for someone to say, to get to that reality.
I think so. I agree with you. I certainly wouldn't argue that. That's true. And then to find geriatricians are very hard to come by these days. And usually geriatricians are doctors that focus on older adults. So we used to really think older adults were 65 and above, but as people are living older, like 65 seems young sometimes. So, but they're primary care physicians with a focus on things that are very pertinent to people who are older. Sometimes some medications, they work differently in the bodies of older people. And a geriatrician would be very attuned to that and work with a family with that. So that, how to find a geriatrician. I think it's actually really hard. We have two geriatricians at our center, and I guess I would say you could go through your local hospital. That would be one way to find a geriatrician. But I would also think a primary care physician would also, that they would be able to do these tests. But a primary care physician that really focuses on working with older adults.
I know when I was seeing the changes in my husband, and I guess I would still encourage your audience to, when you see something that's changed in your loved one, because they may not say that they are like Mr. Cash's mom noticed the change in herself, but my husband hid his. He didn't want to talk about it, but we noticed it. And so we had to be the ones to come out of denial that something was going on. And once you do that, even when I did so, my husband was resistant to it. And that's the bit I encouraged him, just let's go to the primary care physician. And I expressed my concern with the primary care physician. And then he took it from there as to what steps that he wanted to take to try to get my husband to at least allow him to administer the cognitive test. That's just a start, because you may have, like I said, a person who is resistant, or a person who is not admitting that anything is wrong with them, but you've noticed that. And so we have to step up and not turn our backs or turn our heads to the fact that there is definitely something going on, and we have to take control as cautiously and as lovingly as we possibly can to get them the help early on.
And Pastor, sometimes I think that it's really important for doctors to ask about it, even though patients come see me for cancer follow-up, right? They're in survivorship, their surgery is over, but to ask them, and also their caregivers, how are we doing with other things? How are we doing with our energy level? How are we doing, with our diet? How are we doing with our memory? You know, and open the door for those sorts of conversations. And so, Ricky, to your question, sometimes caregivers have to bring it to the attention of the doctor so the doctor can ask the patient and start that conversation too, so that it can it doesn't seem like you are pulling the rug out from under your loved one who has taken care of you their entire, you know, like
Right.
it's your mom, you know, and you
Right.
want to be respectful of that, and you want her to have as much autonomy and agency as possible. But if you see some things, you know, sometimes you got to bring that to the attention of a nurse or a navigator, or the physician, and we should be asking about it. And I don't think we do that enough. So that's something to definitely take back as we talk to students and providers, you know.
Yeah, I
I agree with that too. Because I had to go through 3 doctors to get to a point of comfort for me. And the other thing I would say for families that work is that you have to find your why. The why for our family was grandchildren. That was the emotional triggering connection to get my father to act to help move down here. And my mother was always engaged. So you have to find out why. For people without families, you know, I didn't even think about that, you know, what that process might look like. I just pray that they have some type of support system. But, and it's a continual process. But I would have to say for families, and I was listening to Pastor Jordan, you know, you have to find out why. That emotional connection was the kids, the grandkids for us.
right.
That's great. I got my mom an Alexa to help her with her memory. When she sort of forgets that, well, just tell Alexa, you know? And so I don't know. We'll
I
see.
bet that's a really powerful tool. You know, Dr. Karen, have you found any how technology is helping folks with Alzheimer's?
Yeah, so that's one of the things that we definitely work with, and there is technology, especially with helping people find objects that they lose. Also things that will help people when they're lost, to help their loved ones and police find them. We're also looking at technology that you can do. So, you know, we were just talking about going to the doctor, getting memory tests. And, you know, I'm echoing what you're saying. Many times doctors don't ask about it. That's why we're saying you have to really advocate for yourself and ask for these tests, and if they're not given to you. But we're looking now at having memory screening on your app. So memory screening will be able to be done at home, and you'll be able to do your own tests and send the results into the doctor. So we're definitely trying to utilize technology as much as possible.
You're on mute. You're on mute, Pastor.
We as caregivers must surprise ourselves of the things that we need to do to help our loved ones who are suffering Alzheimer's, how to keep them happy and joyful, and feeling that they still are a part of our world, of their world. But in doing so, we have to keep them using the memory cells that they have by allowing them to feel that they are worthwhile, or that they've not been thrown apart. So I know I did a clinical trial. I entered a clinical trial. It was called Telesavvy, and it was for caregivers, to teach the caregivers how to interact with their loved one that has Alzheimer's. If your mother loved to cook, then give her the job of doing something in the kitchen, cutting up the onions, or setting the table, so that they feel that they're worthy of something. If they like crossword puzzles, you know, work with them, or not such hard ones, but big ones. I mean, you just keep them active and keep them engaged. And that sometimes it gets hard as the diagnosis goes on and the decline is prevalent. So that's when you need that 24/7 care. And so that's what I found with my husband in the long-term care facility. They have activities for him all day. So he's not just sitting, just wasting away. They're not drugging him up. He's ambulatory, so he's walking. If he wants to walk all day, somebody will walk with him and they'll have a conversation. So, I mean, we as caregivers sometimes don't have the tools that we need to keep our loved ones as active as they can be. And so when you get to that point, that's when you need help and you need to decide within yourself that you're going to get that help and look for the resources that's available for you to provide that for you.
Right. And you have to make that call and say, okay, here we are now, and I do need more help, and admit it, or, kind of come to grips with, like, I think JC, what you guys did was, okay, we need to do something
Yeah.
as a family.
It's critical to be proactive too. So, you have to make the hard call and push forward with it instead of, you definitely don't want to be reactive in this type of situation. So, and then again, you try to empower your parents.
Yeah.
So, hey, these are our options. You can live with family members, you can go to assisted living, or you can have in-home health care.
Yeah.
Now, I'm so thankful and blessed that they have, they're both federal employee retirees, and we have the financial means for all three of those options. And they elected on the appropriate option. But they also know as time goes on, those things could change. As a caregiver, it's critical that you have power of attorney, healthcare power of attorney, will, and living will, because you don't want to be placed in a situation or a family situation with siblings or what have you, that you have to, again, react. You want to be proactive in your planning process. So I would say for all caregivers out there, you have your legal reviews, your financial reviews, and you need to engage yourself. Yes, we think we all just rip open our shirts and there's a big S under there. But, even super people have kryptonite. So you need to address where your kryptonite is for the betterment of everyone as you move through this process.
And that's absolutely so important, because that was one of the things we really discussed in our caregiver group on last Saturday. And the people on that platform to talk about power of attorney, because most oftentimes when you're struggling forward or grappling at the end, it becomes a hassle or a fight within the family, where you need to get together now to see who is going to be the person, or maybe your loved one now can say who they want to be their power of attorney before it happens, because then you get an infight as to who thinks that they're going to be the ones, or they should be the ones responsible. So you need to talk about it early on so that you don't have those conflicts.
Yeah. So even if you think about it, what if your mom had gotten breast cancer after her Alzheimer's diagnosis? It would have been a whole different conversation about the decisions that you make, with that disease, with any disease really, but just having all those things in place to help deal with it is really, really critical, right? Right.
You guys have any other tips for caregivers who maybe are struggling with frustrated loved ones who are experiencing Alzheimer's dementia? Maybe they're trying to ask or to keep their loved ones busy, and they're bossy, and they're, like some of the personality changes and some of the day-to-day dynamics as caregivers try to give care to their loved ones. You guys have any advice for that?
First of all, support groups. Again, I recommend Alzheimer's Association. I also recommend one of our former clients, AARP. I think they're doing a great job with their caregiver websites and comments. You have to have a support system. So whatever that looks like for you, you have to have that. And you have to have a relief pitcher, I like to call them. When you've just thrown as many pitches as you can and you just can't get a strikeout, you have to have somebody. And so I'm thankful, I have 3 relief pitchers here. I'm struggling, and my prayers are going up for those who are more isolated. I don't have those answers right now. But I do know that you have support groups. I'm on a Facebook Alzheimer's support group, and we help one another there. So I would like to hear Pastor Jordan, especially coming from a faith-based position too, on that.
Yeah, you have to find a support group. I mean, there's support groups, so you look in your community to see where those support groups are, because that's how I got so involved. I know I needed to talk to somebody because I was not going to be able to handle it or understand it myself. I did feel like I was all by myself, that no one was struggling with this but me. And so I did find a hospital in my community that had a support group that met once a week, that I went. And I talked so much until they invited me to come to the Alzheimer's Association meeting that they had and asked me then to talk my story. That way it helped me to be able to talk about the story over and over again to people, and I can encourage people to say that, you know, you can do this. You can get through this, but you have to have the support of others to help you to roll on this journey. And that's the reason that our support group, Women of Faith, caregiver support group, meet with people every month so that they can come on this platform just to talk like we're talking now. And you'd be surprised at the tears that are shed, but the pressure and the stress that is relieved during those conversations. And to encourage the caregivers to go out and treat yourself. Get a manicure, get a pedicure, put yourself in your appointment book so that you can make time for you, because you definitely need it.
Or go get a mammogram, or go take care of your health, or go, go do all those things that really, you take some time for yourself, take care for yourself, and do the things that you need to do, right?
Yes, you have to be regenerated.
Yeah.
I want to
You
really
can't do it
quickly,
alone. You
Yeah.
really can't do it alone. And even I know that some people that we work with, they just aren't lucky enough to have large families that help them. But even if it's just them and the person that they love who has Alzheimer's, what we do is we work with them to find how we can get respite for them. And in the Alzheimer's Association, I mean, they just have an incredible amount of information and support that they can help you with. They even have respite programs where they'll help you to have someone come into your home just so you can get a break to go get a mammogram or a manicure. But I think the worst thing that you could do is try to do this by yourself. It's just something that you can't do alone.
It's like breast cancer. We say no one fights alone. No one fights alone. And we actually have a couple of breasties that I talked to earlier today who are dealing with breast cancer themselves, but also taking care of a parent with Alzheimer's. And they're really struggling with how to like do the care they need for themselves. But again, I think it goes back to, you can't do this alone. You got to get some help, whether it's from other family or you may have to outsource it for something. But from what I'm hearing from you guys, it's really impossible to do alone when you're not sick. But think about having your own issues going on. You got to help.
the other thing is that I feel we're already here with a caregiver tsunami and an Alzheimer's tsunami. And so we have to really think about how things are changing. So whether you want to talk about the pandemic that's going on, this other reawakening of social impact, because I've been through enough of it, Rodney King, how far back you want me to go? So government, companies need to be involved. And I'll just keep it with brass tacks with business. I mean, if you're a caregiver and you're working corporate and you're trying to climb your corporate ladder, or you're an entrepreneur, it's going to impact you also if you have to be a caregiver. So now companies are going to be impacted by the quality of work. You have great workers who now have to do a pivot, just like we all did the pandemic pivot. There have to be a pivot because of lifestyle and life stage that's impacted to be a caregiver. I don't have the answers, but I know the tsunami's already there. And it's up, just like we are addressing things with the pandemic and addressing things with social impact. The bottom line, I mean, keeping it real, if you want to keep your businesses going, things at a proper level, we need some type of collective support. I know the medical community is doing it, the Dr. Marshes, Dr. Mo's of the world. Ricky's doing it on the advocacy side with the pharmacies, but we still need big business and government to address this, or we're going to suffer more, not just emotionally and loss of life and quality of life, but if you want to keep it brass tacks, business is going to suffer too.
Yeah, I think
And like everything else, when America has a cold, people of color have the flu.
have pneumonia.
Absolutely right.
Right,
Absolutely.
Right.
I'll jump in here and say, on the subject of having loved ones with dementia who then get diagnosed with breast cancer, the National Comprehensive Cancer Network, the NCCN, which is the cancer Bible that most doctors follow. It's the group of rules of how we diagnose and treat breast cancer patients, has begun to pay a lot of attention to the functional needs and the cognitive needs of cancer patients so as to not overtreat or do more harm. And so it may be possible for your loved one, if they're diagnosed with breast cancer, to just have that lumpectomy and forego radiation and forego chemotherapy. You know, I have patients who, I saw a woman yesterday, she's 93 years old, some functional decline. You know, overall she was doing well, but she opted out of a lot of the treatments that are kind of more harmful toward your cognitive function. She said, well, I'm 93, you know, I'm not going to do these things, but I will remove that lump. I will take care of this local problem. And so just because your loved one has Alzheimer's doesn't mean that they can't get treatment for breast cancer, but you should talk to your doctor about that and make sure it's appropriate and that we're not over treating or doing harm to your loved one. So I just wanted to say that because we do run into this problem. You know, we find a lump, mom lives at the nursing home, or, you know, nobody knew because she wasn't getting mammograms, and all of a sudden we got an issue. What do we do about that issue? Even the surgeries can be done with local so that those patients don't have to undergo deep anesthesia that can affect their memory. They don't have to spend the night in the hospital anymore. So there's lots of things to do if you choose to do something, but definitely talk to your doctors about that and advocate for them to do no harm. That's what we're supposed to do.
Right. But even Mo, you bring this up, my aunt died of breast cancer in a nursing home. And she'd been in the nursing home for, oh my gosh, probably 10 years. And she was in a different city from my stepdad, who was really her caregiver. And we thought we were taking care of her. We thought they were taking care of her. We were taking her to the doctor and doing all her regular checkups and everything. And all of a sudden she got diagnosed with breast cancer and she was dead a month later.
Nobody's doing breast exam. Well, I shouldn't say nobody, but infrequently things like
Yeah,
breast exams happen
yeah, she was
infrequently.
83. So she wasn't, you know, she was still young and could have dealt with it, but no one's checking her. Like, I don't know, there's so many, this is like so many things. Again, how much work to do. I mean, I think it boils down to having the right care and being able to give your family member the right care at the end of the day, right? That, you know, but if you don't have it, or you don't, or, you know, it's not being monitored constantly like you're doing for your husband, Pastor, you know, anything could happen, right? Much work to do.
Indeed, indeed. Dr. Karen, are there any trials or therapies that folks should be on the lookout for, or websites they can check to look at clinical trials if they're thinking about enrolling themselves or their loved ones? Anything we can put in the chat?
Sure, there's a website, clinicaltrials.gov, where you can find some of the trials that are going on right now. There are some exciting trials. We do clinical trials that do have a drug. We also have clinical, and there's some very exciting drugs that have been in clinical trials. One of them is aducanumab, which is by Biogen, which I think we could say many people are very excited about right now, and I think it's awaiting FDA approval. There are also some other compounds that we have by other companies like Eli Lilly, but the best place to go would be clinicaltrials.gov. The Alzheimer's Association also, you can go on their site and search for Alzheimer's trials.
Clinicaltrials.gov is like going into hell upside down with your hand tied behind your back. It is a horrible place.
Try the Alzheimer's disease,
Okay.
the Alzheimer's Association site.
We hate that one for breast
I'll
cancer.
try to
You don't
put
like
that link.
clinicaltrials.gov?
Oh my
It's exhaustive. It's a lot. It's a lot. But I'll try to put that link for Alzheimer's in the chat for Facebook followers.
hate that one. It's so hard to navigate, especially if you don't, know, you really have to be somewhat educated and really understand your physiology to really figure out if it works for you. So if we can have more help, that would be great. We'll go there, but
Any last minute tips or advice for our folks who are watching, who are caregivers? I think we have driven home the point that they can't do it alone. and that they need to find their tribe, right? Find their support, especially if they are doing it alone and family members are not sharing in that responsibility. But now, how about any other advice for our caregivers watching today?
I mean, just like when you get on the airline, please place on your face mask first before trying to place your face mask on others. You have to take care of yourself, my fellow caregivers. I'm actually working with a group now. We're trying to do a non-for-profit startup of caregiver.org because, again, the tsunami is here, not just in the Alzheimer's dementia space, but in other spaces. And it's going to impact younger people. I mean, 30s and 20-year-olds. If you look at the fastest trend of caregivers, it's in the 30 and 20-year-old groups because this is, happening faster. But again, hope transitions to faith. Faith transitions to, an opportunity. That's all I can share. You have to have support groups. You can't do it alone.
Yeah, and I would ask too, Dr. Karen, when you say you could potentially have Alzheimer's 25 years before you have a symptom, that's really scary. Like, how do you even check for that? How do you know? How can you even prepare yourself for that? Is there anything you can do to identify that? I mean, we know that somewhat heredity can play a role here, but how should we check for that?
It's interesting because I had this conversation yesterday. Well, there are two questions because we can check earlier in the disease, so before there's symptoms. So you can have PET scans that monitor amyloid and tau in the brain. So that technology is available. There's scans that we do regularly at our center. But there's a larger question, like, for one, what does that actually mean? So we can kind of maybe guess based on some of these tests that you have a higher chance of having Alzheimer's disease. But before we give out that information, there are a lot of questions of how does that affect your life? And
you really want to know.
Well, yeah, I mean, is it going to affect you in a negative way to know this much earlier in your life? Certainly want early diagnosis, but to tell people in these preclinical stages that they have more amyloid or more tau, and that's really all we're telling them. And we think that you might, and it's always we think, you might get Alzheimer's in years to come. We have to really weigh the benefit of that information, and if it's even worth sharing. And people have to ask themselves if it's worth them knowing.
Mm-hmm. Mm-hmm.
One thing we haven't talked about too is diet, exercise, all the things that you can do. You have to research. I'm a sandwich caregiver. My wife is a 3-year multiple myeloma thriver. And then I take care of my parents too. And one of the things I know she's done is just change of her nutrition, change in her exercise. And so that's not something, again, we as people of color under index in those areas. So what are we doing proactively with our diets? I mean, I think if you keep drilling down into health and wellness, diet and exercise are still big things. And I'm not just throwing it out there like you see in a commercial, diet and exercise. You need to really spend time doing that because it's important. And we transitioned that to my parents also. They just had, they're 86 and 82 respectively. They just had their semi-annual physicals. And the doctor was like, overall, functionally, they're doing great because of the diet, exercise that we're providing them. And so as we look at Alzheimer's, we look at anything else, what are we doing? What can we do more? Instead of, again, being reactive, what are we doing to be proactive with our life and our lifestyles?
And research is really showing that changing these lifestyle factors does have an effect on if you will get Alzheimer's when you're older. And John is absolutely right. So diet is one of them, and we recommend that people have that Mediterranean diet. Exercise, social support, we're also seeing has a big effect on people. And I don't think we should underestimate the effect that these lifestyle factors have on if you are going to get Alzheimer's in your later years.
It's true. Miss Gloria, can I ask you a question, ma'am?
Yes. Oh,
What's bringing you joy these days? What makes you happy?
Well, the fact that I have listened to the area, I have listened to many things today, and I really appreciate the kinds of things that I have heard and know about. Because what you all have been saying, a lot of it is what I'm with. It's with me now. And it's been like that for several years. But it's not getting worse. So it's all right. It's not getting any worse. And the fact that it's not, to me, is not getting any worse, that I can keep on keeping on and doing what I'm doing now and receiving the kinds of meds that I'm receiving now. So, but so far as pains here and a pain there, I haven't had that. And that's something that is also good to not have to worry about.
Blessing.
So therefore, I am relaxing, I'm taking it easy, and I'm waiting for the nice things to keep on keeping on.
That's right. You're doing something right because you look good.
You're surrounded by love. I know those JC.
Right.
Yeah, I surrounded by love. Well, you guys are awesome. Thank you so much for sharing everything that you shared. I know we've enriched a lot of people, and how can people reach you?
Me, I can be reached at Karen, Karyn .marsh, MARSH at NYULangone.org. Or you can Google NYU Alzheimer's Disease Research Center.
Awesome. Pastor Jeanette, can people come to your support group?
yes. For information, they can email Women of Faith 007 at gmail.com. And I will make sure, or one of the staffers will make sure that they get an invite to our next support group meeting, which will be at the end of April. I think it's April 24th. It's on a Saturday afternoon.
Right.
This
Got
is
it.
awesome. This has been an awesome chat. And I thank you both for inviting me to participate in this forum. Looking forward to continued connections and partnerships as we can all help one another. We should not let this be our last time together, but there's much work to do. So we have to do it together. We cannot do it by ourselves.
Mhm.
We thank Biogen for sponsoring this episode of our show and giving us lots of resources. And for the breasties that want to talk more about this, we have our Touch Talk. We actually have it this weekend on Saturday, the first Saturday of every month, but we can make this a conversation of our Touch Talk.
Mhm.
And our next Touch Talk are coming up in the future to talk more.
Absolutely.
Caregiving.
Mr. John Cash, JC, how can people reach you if they want to support you and helping with this nonprofit? Is there any way that people can follow you or anything on social media?
Sure. They can follow me on Twitter at John L. Cash. You can follow me on LinkedIn. Just look at John Cash MBA. And then you can follow me on you can email me. I don't care. John, John, Lewis, Lewis, Cash, CASH, JR @gmail.com. Heck, Ricky knows how to track me down too. I'm just thankful to be among the women, the rock stars here. You guys keep doing great work and keep doing great things. And Biogen, again, thank you for your support.
Mhm. Well, we hope this has been relatable and reliable and real. And it's what we set out to do every single Wednesday night for almost a year. So thank you for joining us. We're here every Wednesday night at 6 p.m. Eastern on blackdoctor.org, for whom we're so thankful for this platform. So thank you to our sponsors, to our guests, to all of you for sharing your stories and your wisdom and your pearls. We just we appreciate your expertise, Dr. Karen. Thank you so much.
Thank you for inviting me.
Thank you so much. Happy Easter, everybody. I love you, Mo.
Happy Easter. I
Thank
love you too. I'll see you guys next Wednesday night.
Yeah.
Freshly love.
Happy love.
Bye, Mom.
Bye.
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 To our hearts.